May is Stroke Awareness Month. We're joined today on Medically Speaking by Adnan Siddiqui, professor of neurosurgery at the University of Buffalo, a member of the Gates Vascular Institute stroke team, and the chief medical officer of the Jacobs Institute. Doc, thanks for joining us today.
It's my pleasure, Mike.
If you can, first, tell us a little bit about the team at the GVI and how you guys have been attacking the stroke syndrome over the last, say 5 years.
So we have been champions of providing stroke care since well before GVI. While we're still at the old Gates, the slogan "Get to Gates" has been popular in Buffalo for at least a couple of decades for stroke care. And so we have been leading that charge for a while. And so we've been running really strong. Buffalo is one of the best areas in the country for stroke care. Our team has been solid and doing what we do without change, I would say, for ever since we got to the GVI.
Sure. Let's start at the beginning, though. May is National Stroke Awareness Month. If you can, for the viewers out there, can you discuss the signs and symptoms of a stroke?
Stroke is a malfunction in the brain. It can be caused because of typically two problems. Either there's a blockage of a blood vessel that is carrying blood to the brain, or there's bleeding of a blood vessel that carries blood to the brain. Either one of them suddenly causes a dysfunction in brain function. So you suddenly lose something. So you suddenly lose your ability to speak, suddenly lose your ability to move, lose your ability to see, lose your ability to feel. And typically, because stroke or bleeding occurs on one side of the brain or the other, it typically affects one side or the other. So the symptoms that you're looking for is a certain loss of function. And the way we talk about is FAST. F is for face. So suddenly if you develop a droopy face because your face is not moving. A stands for arm. So suddenly if your arm starts falling down because it is unable to sustain itself and it's too weak, you can't lift it. S stands for speech. So suddenly you start mumbling your words, or you can't speak, or you're speaking but it doesn't make any sense, or your speech becomes severely altered. And T stands for time, to make you aware that you gotta hurry. Time is of essence because you are killing brain cells by the second. And the earlier you get to the hospital, the more likely you are to make a good recovery. So if you get to the hospital and we can get the blood vessel completely open within 2 hours, there's a 90% chance, 90%, you're gonna go back to normal. But if you wait another 4 or 6 hours, there might be a 20% chance you can go back to normal. So time is of the essence. Face, arm, speech, time, fast.
That's great. So as we talk about that, when you talk about getting to the emergency room and how, time is brain in this sense, how important is it for those who sometimes may, one, ignore symptoms, two, think that they'll go away, or three, they're just too stubborn, they just don't want to go to the emergency room? So I'm sure oftentimes you see this. What's your message for those who maybe fall in those categories?
Yeah, that is such an important point, because let's just compare this to another condition that we are all very familiar with. There's a lot of education, a heart attack. Let's compare the two conditions so that people understand what's so different about stroke. Well, heart attack, the person's brain is working. They have no problem with their brain function. They have not lost 30 or 40 points of IQ over the last few seconds. Second, it's painful. A heart attack is painful. It causes this crushing pain in your chest. It's pain going down into your arm. You feel this sense of dread. So your brain's working and it hurts a lot. People call 911 without much delay. And, that works really well for a heart attack. With brain, the most common response by people who are actually having the stroke is take a nap, because they're not thinking about it. Most people are not lucky enough to have a lot of people around to say, hey, you're acting differently. No, that's not normal. You better get to the hospital. Most people are by themselves and they think, well, maybe slept wrong. They're not thinking well. And so it's really important for people to educate themselves so that when something like this occurs, that they do think about, oh my God, could this be a stroke? And it's most important for caregivers, for family members, for friends, for people who are around a person to say, no, this is not something you're going to sleep off. You've got to get to the hospital right now. So you have to know that when you're having a stroke, the first inclination, the first instinct you have is to sleep it off. Ignore it. Please don't.
Sure. So, Doc, I know that we've seen some stories. People are avoiding the hospital. And, while we're in the middle of a pandemic and COVID-19, your message for those out there who are watching about not ignoring it, or people who are afraid to come to the emergency room because there's COVID-19 patients here. Stroke doesn't seem to discriminate whether there's a pandemic or not, and there are people who are still suffering. What's your message for people now during this COVID-19 pandemic?
You look in the DC metro area and New York City area, the total number of stroke interventions, the total number of strokes, the total number of myocardial infarctions, interventions for heart attacks, STEMI interventions, they've all declined 40%, 50%. It's not that people are healthier. It's not as if their stress has gone away. If anything, the pandemic has increased levels of stress in people rather than reducing it. What has gone up is this massive rate of people dying at home. And I think it's really important for us to get this message out that the hospitals are open. We are out there. Yes, we are on the front lines, but we are out there doing our jobs, and we are doing it well. And we are treating patients who come in. But we can't treat you if nobody ever knows you're having a heart attack or you're having a stroke. Because I know you are. There's nothing that has changed over the last couple of months.
Sure. So let's talk a little bit about the safety message. I don't think people understand exactly how safe it actually is in the hospital, including the emergency room, with all the precautions that are taking place in terms of restricted visitation, universal masking for employees and even patients. We're monitoring employees and visitors' temperatures as they come in and out of the facility. The cleanliness efforts that are going on. I mean, you're in the throes of the emergency room. We often say that it's actually safer in the hospital than it is, say, at the gas station or the grocery store. You can easily get the infection out in the community versus in the hospital. You see this, the efforts that are going on. What do you tell your patients or their loved ones when they come in?
So my message is exactly what you said here, Mike, is that things are safer now in terms of being able to protect the patients and the healthcare providers from COVID than they were sort of 2 months ago or 3 months ago before all these things got instituted. So everybody gets tested for COVID once they come in as patients. We are increasingly testing our own staff with antibodies as well. And we have treated many COVID positive patients. And really, from our standpoint, our interventional suite standpoint, we have not had anybody fall sick despite the fact we have taken care of people because of the protections that are in place for the patient and for the caregivers. It's important to note that, there are things that are being done differently. So yes, normally we like to have family be there with the patient, but that's just not safe right now. So we're not doing that. And there is a human side to that we all need to accept and acknowledge, that patients are by themselves in the hospital more so than they would be in normal circumstances. But it's for the benefit of the patient and their caregivers and the family and the healthcare providers. So overall, between all the measures we are taking from the standpoint of how the workflow occurs, makes it an extremely safe environment. And the bottom line is, if you're coming in for a hospital procedure, be it emergent like a stroke or heart attack or a brain hemorrhage, or urgent like a hernia or a brain tumor, we are prepared. We know how to do our job. We can do it safely.
May is Stroke Month. Dr. Adnan Siddiqui, a member of the Gates Vascular Institute, has a very simple message. Stroke does not discriminate, whether it's in a pandemic or not. Doc, thanks for joining us today.
It's my pleasure, Mike. Thank you.